Good morning. This is Dan Morton, and I'm talking to Bernard Harris and Ed Harrison with Pikes Peak Strategic Group. And today I'm just going to ask them some questions about discount medical plans and discount dental plans, and American Plan in particular. Good morning, gentlemen.
Good
Morning.
morning, Dan. Pleasure to be with you.
Oh, same here. I'm glad to have you guys and glad you could take a few minutes out of your day. Ed, I have a question for you. How about we start with you?
Okay, let's do it.
I want to ask, what is AmeriPlan?
AmeriPlan is a discount. It's a discount company, a medical company. It's started in Dallas, Texas, outside of Frisco, Texas. There, it's a 23-year-old company. It specializes in discount dental and healthcare products. We're not insurance. I always let people know that we're not insurance. We complement insurance. The company, like I said, was founded in 1991 by two gentlemen who found the need for dental programs for not just the Texas area, but we have expanded into 44 of the 50 states. And what we do is our number one product is our dental program, our family dental, which is $19.95 for entire household, and our single dental, which is $14.95, where you get dental, vision, prescription, and chiropractic. So the company was founded on that dental program. That represents about 85% of our business. We are affiliated with the American Dental Association, the Better Business Bureau. We've been seen on Good Morning America, been written up in several Wall Street journals and other business journals. So the company has been around for 23 years. It's a proven company. It's a $500 million company and growing. And what we're trying to do is get the word out to our fellow Americans about this fabulous company and what we can do to support the new federal health care law. Once again, we're not insurance. We simply complement that program with our dental, vision, and chiropractic program. So, like I said, the company's been around for a while. It is a reputable company. It's just A+ with the Better Business Bureau, and we're just doing an outstanding job to support our fellow Americans here. So that's just a little overview of the company, Dan.
That's a good answer. Bernard, how does AmeriPlan work?
AmeriPlan works by having the members go to the website. They look at the provider listing at www.ameriplanusa providersearch.com. They select the provider that's near them, or they find one that in some cases their provider's already listed for dental, vision, chiropractic services there. And it is just an incredible way to do business. And I think in simple terms, the entire company is online, which makes it so much easier for our benefit members to use the services. And the great part about it, you pay the provider directly. We take the middleman or middle person out of the picture, and the provider, he or she gets paid right on the spot. In some cases where the member does not have all the cash available, in most cases the provider will put you on a payment plan, but still he or she is being paid directly. In cases with the insurance companies, they have to fill out forms, and the provider might not get paid totally for 5, 6, 7 months. So, I think they love it from the standpoint they get more volume.
So the discount medical plan and the discount dental plan sounds like it's a lot more streamlined bureaucratic-wise than going through an insurance company.
Absolutely. And another great point about using our services, while you're traveling across our great nation, you can still go and use those same services again by going to the company website. You need a prescription, you need to see a dentist while traveling, you're getting a professional provider that's going to give you good services.
So you don't have to be stuck in your house or your hometown to actually take advantage of the program.
Absolutely not. No.
Ah, perfect. Ed, I've got a
Yes.
question for you. Let me change the screen here. How about pre-existing conditions? A lot of people have got pre-existing conditions, and that may be one of the reasons that they're afraid to get insurance or afraid for the cost of insurance for the pre-existing condition. How are they handled?
Well, based on what is happening with our new Affordable Care Act, pre-existing conditions are not involved anymore, either with that program or with our discount programs. AmeriPlan, I said as before, at the forefront. That was never part of our program. Pre-existing conditions. We take all people who want to join our program. We do not restrict them from 18 to 80. So pre-existing conditions is not anything that our discount program needs to deal with. We try to get people, number one, educated on what AmeriPlan is all about, fit them, give them an opportunity to pick the provider that they feel comfortable with. So pre-existing conditions is not it's not a problem with AmeriPlan. Like I said, we take one, take all. We don't discriminate. We just want you to be healthy and save money and get quality service.
So a pre-existing condition would not stop me from signing up and taking advantage of the program.
No, if you sign up today, let's say you needed one of your kids fell and cracked their tooth or something. If you sign up for our dental program today, you can pick out a dentist in your local area, whether it's here in southern Arizona or there in Colorado Springs or anywhere of the 44 to 50 states. You can go to the dentist today and get your young person teeth repaired and send them along their way. So pre-existing condition is not a condition with the discount dental plans, Dan.
Okay, that clears things up. Now, how about a pre-existing condition, though? I'm sorry, a waiting period.
Waiting period is no waiting period there at all, Dan. If Bernard or I or some other individual on our team signs up someone today, for instance, with our dental program, we can get you a number and you can use it today. The only exception would be with our health program, which you have to wait 3 business days before you can see an actual medical doctor. But other than that, all our services, chiropractors, dentists, get a prescription. Vision program is a big program, not just with our young people, but also to our citizens throughout the country. The glasses that you see that I have on were purchased through our discount program, where I received a significant discount for using my own services. So it's very important that people get involved and get educated about discount programs.
So Bernard, it sounds like a great program. So there's got to be a catch here. It's got to be pretty expensive, right?
Absolutely not. Again, the best analogy that I can give you, AmeriPlan is to medical services like Sam's and Costco are to marketing food and bulk items that you need in your home. We bring together the very best of medical providers across our great nation, make them available, and again, the providers win just like the members win. They get more customers. People are then able to make probably the best advertising in the world, which is word of mouth. And it must be working. The company's been around, like Ed said, over 21 years. They are growing. And last year, I spoke with one of the regional vice presidents, and the company's worth over $500 million. And it is continuing to grow. On the corporate call yesterday, the owners, Dennis and Daniel Bloom, are just happy as can be with the number of people that have joined the company in the last couple of months. It is incredibly awesome.
So I heard something about pharmacy and vision and chiropractic. Are those extra cost services?
Absolutely not. No, they are included in the dental plan, and I might add that the plan covers dental, vision, prescription, and chiropractic services for an entire household, not just your family members. The household, that is critically important for all of our customers and potential new members to know. So if that is the legal residence, extended family that live with you, they are also covered.
So, Ed,
Yes.
I have a question here about if I have health insurance, how does the Ameriplan work with my health insurance? I mean, is it a complementary, or do they fight each other?
Well, what we can do with our health program, which is a 49.95 program, for, as Bernard says, with your entire household, what we do is we complement your health program, whatever it may be, Kaiser or Blue Cross or a number of the other private health cares and out there. We do not tell people that they should not have basic insurance. We believe people should have basic insurance. So the ACA is helping a lot of people. But what we do is we complement your insurance, because I just was reading some stats here in the local Arizona paper this morning, and our premiums are going to be going up. And you're getting a lot of private companies and others, and out-of-pocket expenses are the big thing, Dan. And what we can do with our discount dental program, once again, for $49.95 for an entire household, is that we can help with those out-of-pocket expenses. Because a lot of people don't realize when you have, you may be getting a low premium in many cases, but you have a high deductible. That's how you can get that low premium. So, say for instance, if the average premium could be, maybe $150 or a couple $100, but that deductible may be $5,000, and the average American has to realize that you have to come up with that $5,000 up front before your insurance kicks in and assists you with all these expenses, MRIs and all these other things, where our discount dental program can help you with the MRIs and the CAT scans and these other programs, which will complement your basic insurance plan, Dan.
So they basically work together.
Yes, they work in tandem.
Okay, now what if I have Medicaid? How does that work?
Well, Medicaid is a little different. That's pretty much a government-run program. What we can do, and that is primarily geared to kids under the age of 18. So, but the kids may be covered by Medicaid or Medicare. Medicare is for seniors, but with Medicaid, that's really directed through the state, through each state. They have a program, and they usually take care of pregnant women and young kids. But it doesn't cover the adults. So the adults, with our dental, vision, and chiropractic services, a lot of times adults will go without maybe basic healthcare plan, a basic healthcare plan, because they may be on Medicaid. But we know if mom and dad has a serious situation, that can hamper everything in the family overall. So we encourage people, especially the adults, even though their kids may be on Medicaid, that they need to have some type of health coverage. So that's where the ACA can come in and help some of these people. And that all has to do with their income. Once again, I'm not an insurance agent. Bernard and I don't pretend to be an insurance agent, but people need to talk with their medical people, people who sell insurance, or these private companies out there. But we are here to complement the ACA and the other private insurance companies, Dan.
Okay, that makes perfect sense to me. Bernard, how about emergency services? What if I have to go to the emergency room, break an arm, get a sore throat or something that I can't treat at a doctor? How does that work?
Great question. I think using the Ameriplan services are going to save you a lot of frustration and a lot of money from the standpoint that there are still people in America that haven't even signed up for the Affordable Care Act, and they will wait and wait and wait. And the emergency room or their hospital will get their money one way or the other. With Ameriplan, I can almost with great assurity tell you that you're going to incur a bill of over $2,500, which immediately allows you to bring into play your Ameriplan services. And at that point, you're going to be given an advocate through the CARES group, which has been with Ameriplan for many, many years, and they are going to take all of those emergency room bills, combine them into one, and get you a payment that fits your budget, not mine, not Ed's or anybody else's, that fits your budget. And there are cases of Ameriplan members using, I think this was maybe 4 or 5 months ago, one member had 3 kids or 3 family members that used those services, and they still marvel at how easy it was and the payments. We have just an absolutely incredible plan using our emergency services, and you can use it in virtually any hospital in our country.
So there's not a restriction on hospitals normally. I mean, you don't have a
Absolutely not. No. Even in the states where we're not allowed to present or market Ameriplan, you can still use those services. I would also add that we have our AmeriDoc service, which, you know, if you're traveling, you get sick, you will be talking to a licensed physician, and he or she, if they deem it necessary, they can direct you to the nearest hospital and pre-announce you.
So now, could you elaborate a little bit on that? Maybe.
Let's say you know, we're in Colorado and we're on the road, and say we're near the border of Utah. Something happens. You can speak to a licensed physician on your cell phone, or you can do just like we're doing. You can talk to the doctor via computer, and you can explain what your problems are, and then the doctor can make a diagnosis if he can, and if he or she feels that it is an emergency, they will call the hospital nearest you and get the word to that doctor or that hospital that you're coming, so that they can go ahead and be ready to take care of your medical issues.
That's almost unheard of, isn't it, actually speaking with a doctor?
It is, because a lot of services have you know, nurse lines, and nurses in our nation are very, very capable. However, you're getting a licensed physician that's going to help take care of your issues, for one. Two, the insurance companies have adopted this same program. However, we charge $17.50 per use. They charge in the neighborhood of $40 or more for each use.
Wow, that's fantastic. So, Ed,
Yes.
why would a physician or a provider want to partake or participate in the Ameriplan program?
Well, I guess as a professional, reason why the providers really sign on with us, because they have entered into a contract with the Ameriplan to provide these services, and number one, they get paid right away. So if an example, if you go in to get a tooth extracted today, and hypothetically it costs $175, and you may only have to pay $100 of that $75, you pay that doctor that $100, and you're virtually finished. He doesn't have to file any paperwork with anyone because that business deal has been completed with you and the patient. So he doesn't, the doctor, he or she doesn't have to bog down their staff with filing paperwork to a to an insurance company or anything of that nature. So, and plus that, what the providers like, it's a way of building new business for existing providers and the new doctor and dentists who are coming who are coming out of school and maybe establishing their practice. So it's a win-win for the provider as well as the patient, especially with the paperwork and all the overhead that it takes in dealing with your average insurance company.
So it sounds like the providers are happy to see you coming because A, they know they're going to get paid, they know how much they're going to get paid, and they know that when the service happens, the payment will happen there and they don't have to go after you for the payment.
No, not unless it's something extensive, maybe like braces or something. At that point, Ameriplan's not involved in that. I always let people know we're not involved in financing people's braces or anything, but we can save them a considerable amount of money on braces and or dentures. But that provider, that dentist or that medical doctor can set up payments with that particular patient for services, and that would be something that the patient and the doctor would enter into some type of agreement with. That has nothing to do with Ameriplan. So I always like to let people know Ameriplan's not involved in the negotiations or anything of nature like that.
But they do actually set up the discount. I mean, you know what the price is going to be and the discount's going to be before you.
Yes, that's an agreement between the providers and the Ameriplan Corporation. It has nothing to do with those of us who are out in the field marketing the product for Ameriplan.
Okay, that makes perfect sense. Bernard, Ed just mentioned something about braces being covered or being discounted. Is that true?
Very much so. Earlier on, Ed mentioned, that Medicaid covers a lot of the dental issues for kids. For the families not on Medicaid, our dental services are absolutely phenomenal. And I would also point out that braces are probably one of the most expensive items that a family, a husband and wife, can get for their kids, and the average probably $4,000 to $5,000. Our price right now is set at probably just over $2,000, $2,400 per child, and traditionally, mainstream insurances do not cover braces for adults at all. Ameriplan will give you a substantial savings, well over 50% off for braces for adults. And as Ed mentioned earlier, you get put on a payment plan. You get put on a payment plan if you do not have the cash readily available, and the providers are still way ahead of the game because they're being paid up front.
And it sounds like the small payments that you would pay for the Ameriplan program would way more than offset the cost for having braces. Because I mean, how many kids need braces in school these days?
I would venture to say a family with 3 kids, one, maybe 2 of those kids in their lifetime are going to need braces. Mm-hmm. And the first time you use our plan, our 1995 family or household plan, you're going to completely pay for your yearly premium the first time that you get braces for kids. I would also point out the same holds true for adults that need dentures. The same issue will come up. We're going to give you absolutely great savings for those dentures, quality dentures.
And practically any other dental service as well?
I'm sorry, say again?
So practically any other dental service is covered, or are there restrictions on the dental?
A whole host of dental services. Virtually any service that dentist provides is available through the Ameriplan Corporation. Cleanings, x-rays, crowns, dentures, braces. If it's there, it's covered, and there's a plan or a listing that tells you what those deductions are going to be. But right in our normal flyer or brochure, it lists the most common, up to and including what normal dentist, the normal price would be, what you're going to pay to the penny with Ameriplan, and your percentage of savings.
So it sounds like a win-win for both providers and patients.
Absolutely, absolutely.
Well, gentlemen, I appreciate the answers today. Thanks for taking some time out of your day.
Well,
Not a problem.
Hey, it's always a pleasure to be with you, Dan. You know, we look forward to speaking with you again soon on talking about this fabulous company called Ameriplan USA, where we try to save people money, save households, one family, households, save them money on a continuous basis with quality service.
That makes sense, and I just want to point out that we're going to have the link to the website, the Pikes Peak Strategic Group website, below this video, right? And we'll have a phone number, and you guys can actually be reached by phone.
That is correct, Dan.
Okay. Well, thanks. You guys have a great day.
All right, sir. Look forward to seeing you again.
Thanks a bunch. We'll see you next week.
Okay.
Take care.
Bye now.
Bye.